As someone with a history of degenerative disc disease, bulging discs, stenosis, and spondylolisthesis, an issue that I've struggled with is how to get my cardiovascular exercise, which is so important to overall health, without irritating my lumbar spine. And so today I want to show you 5 different cardiovascular exercises that are low impact on the spine so you can get your heart rate up and be feeling good without irritating your back. The first exercise is the battle rope. And this you'll probably have to go to a gym to find, but it is an excellent exercise for getting your heart rate up in a very short period of time. You can use the battle rope with your arms in different ways, but what I've found to be the least impactful or irritating to the lumbar spine is alternating. So using the ropes reciprocally is preferable than using the double ropes because it's going to have less stress on your lumbar spine and be more low impact while having the same effect on your cardiovascular health. The next exercise, using TRX straps and marching at a faster pace. So the straps actually allow you to control your body weight and make it smoother so there's less impact than marching or running in place without the straps. So it just gives you control, and it does also engage your core, which helps protect your lumbar spine. So this is another tool that you'll probably need to go to the gym for, but it is an excellent way to get your heart rate up without the jarring effect of running or jumping on your lower back. Third on the list is probably my favorite, which is sumo walks or monster walks. And these are using a stretchy band, which means you can do these anywhere at home or out in your yard. And all you need is a stretchy band that wraps around your thighs or your legs. So these are fantastic because not only do they get your heart rate up by doing laps back and forth, they also are an excellent exercise for your hip muscles, which are supportive for your lower back. So the unique thing about monster walks or sumo walks is that it activates the muscles on the outside of your hips when you're walking or sidestepping, which is a very supportive muscle for your entire lumbopelvic hip complex, and just allows you to do a healthy, dynamic movement with great spinal support. Sumo walks are going to be sidestepping or walking sideways like a crab, and monster walks are going to be walking in the forward and backward direction to get this muscle and your cardiovascular fitness and agility from multiple angles. The fourth exercise on the list is the Bike Ergometer, which I like because it includes your arms, which then means that your core is also engaged, because the core is the connection between your arms and legs. So normal pedaling on, say, a recumbent bike or a stationary bike may only be your legs, which means your core can be turned off. But by including your arms on a Bike Ergometer, there has to be a connection between your upper and lower body to do that reciprocal motion. It's actually across your body, and so it requires your core to be engaged, which protects and supports your lumbar spine and also allows you to get that cardiovascular fitness that we're after. The fifth and final exercise on this list is the Ski ERG, which is an exercise that involves hip hinging and involves the lumbar spine and the hips. So this could possibly cause irritation in someone that doesn't move with healthy movement patterns or know how to do a hip hinge that involves hinging at the hips and not rounding or bending at the lumbar spine. So this does have a little bit of a prerequisite to it, but if you do know how to hip hinge in a healthy way and use your hips to elevate your torso, kind of like a deadlift, this Ski ERG is an excellent exercise for further developing that hip strength, also getting you cardiovascular exercise. It's kind of mimicking an outdoor activity in cross-country skiing. It also involves your abdominals a little bit as you're pulling down, You don't want to be doing a crunch when you do the Ski ERG, so all of that motion does want to go into your hips like they are a hinge, but your abdominals are there to support and stabilize your lumbar spine and your torso so that no movement goes into your lumbar spine. And this is actually a major role of the abdominals that I think doesn't get talked about enough. The stabilizing function of this muscle group so that the other levers, the arms and legs, can pull on your body and your torso without causing micro movements in your lumbar spine that can cause friction in your discs and wear and tear and breakdown. If you are interested in learning more about activating your core muscles to create more stability and support for your spine, especially while doing exercises like this, a lot of people have really found core balance training to be a helpful guide for learning how to engage your core in a healthy way. So I encourage you to check that out. And we do offer a free 7-day trial that shows you exactly how to engage your core in a healthy way. And I'll be back next week to talk about a different topic related to getting out of the back pain cycle for good. And until then, get down on the floor and connect to your core.